How does interferon-gamma work in an IGRA TB test? Imagine a tiny alarm system inside your body that goes off when it detects a specific intruder. That's essentially what happens in an IGRA blood test for tuberculosis. This test measures how your immune system responds to certain TB proteins by detecting a signaling molecule called interferon-gamma. When someone is infected with the bacteria that cause tuberculosis, their immune system keeps a memory of it. Special immune cells called T cells recognize these TB proteins and respond by releasing interferon-gamma. In the test, a blood sample is taken and mixed with synthetic versions of these TB proteins, mainly called ESAT-6 and CFP-10. These proteins are unique to the bacteria that cause TB and are not found in the BCG vaccine or most other environmental bacteria, which helps make the test more accurate. If the person has TB infection, their T cells will recognize these proteins and releases interferon-gamma. The test then measures how much interferon-gamma is released, either by counting the number of cells producing it or by measuring its concentration in the blood. This response indicates that the immune system has encountered TB before and is reacting to it. The controls included in the test help confirm that the immune response is specific and not just background activity. Because the proteins used are not present in the BCG vaccine, the IGRA test is especially useful for people who have been vaccinated and might otherwise get a false positive with traditional skin tests. So, in simple terms, interferon-gamma acts as a marker, showing whether the immune system has recognized TB proteins. This allows healthcare providers to identify TB infection accurately through a blood sample. It's a safe, quick, and reliable way to screen for TB, especially in people at risk or those who have been vaccinated. Remember, if you think you might have TB or are at risk, always consult a healthcare professional for proper testing and advice.